So TFCC is a ligament type of issue. And of course, just like with fractures, there's a graded spectrum of the severity. Now, sometimes people have a TFCC injury, means they have little tears in their ligaments and they're immobilized for a certain period of time. Now, ligaments hold bone and bone together. And ligaments give the joint structure, it gives it stability. So, what happens when you lose stability? You have to regain it back. So, how do you regain it back if you don't have surgery? You regain the stability back by immobilizing and stiffening it. So, you're essentially using the body's own mechanism of healing, which is to stiffen up and to scar down. And then after that, you start to move. So, the key thing when it comes to working with anyone with a ligament issue like a TFCC is that you want to increase range of motion and strengthening without pain, because pain equals instability for the most part, give or take. Okay, can't go into like a full-on 3-day lecture, but that's essentially the gist of it, right? So TFCCs can be between like, oh, I have a small tear, to I had a really big tear and I had to have surgery, right? So the protocols for those various types can totally be different. If you had a TFCC repair, right? A repair and a debridement. So those two words are completely different. A repair means they have to pin you, sew some shit together, and immobilize for a certain period of time. So usually the general rule of thumb is 4 to 6 weeks. So ligaments, because they provide stability, they need to be immobilized for a little bit longer than you would probably like a fracture or something like that, right? If you had a repair, you'll tend to find that your patients were pinned, immobilized for quite some time. And then once the pin is removed, then you can start your therapy. Now, if someone had a debridement, the word debridement just means they went in there, cleaned it up, and that was it. Now, depending on what part of your TFCC was, your patient's TFCC was torn, that's all you can do. You don't really want to cut into certain parts of the TFCC because there's no blood supply, there's like less blood supply and stuff like that. So again, just understand TFCC injuries, understand their protocols. Don't be scared to work with them. Just know that you have to know how to evaluate your people and know how to do some clinical testing. So I encourage you to do that.